Okay, this video is going to go over Chapter 19, Objective 8, where we talk about calculating cardiac output. So on the test, you're going to have access to a calculator, or you can bring your own calculator. Keep in mind, if you bring your calculator to the testing center, they are going to clear it. You're just needing to add and subtract some numbers, so you could really do this without a calculator, but I'll go ahead and let y'all bring one in. These are just some terms to know. So by the end of this unit, or at the end of this objective, you should know what these words are. So if you don't, make sure you go back and take a look at those and learn those for the test. And these are all hyperlinked, so you can go straight to that term, depending on where it is in the PowerPoint, and it will take you straight to that term, so that way you can make sure you have those definitions and understand it. There is a cardiac output video that Armando Hasudigan has created. There's a handout that goes along with that, so that way you can watch the video. It's about 9 minutes long and follow through. This is in your this is in your lecture manual that you picked up. So again, really good video if you need some more information. So a chronotropic drug is a drug that's going to change the heart rate and rhythm by affecting the electrical conduction system. That's what we talked about previously. And the nerves that influence it. Again, that's part of the conduction system. And it's going to change the rhythm produced by that sinoatrial node. Now, if chronotropic drugs can either be positive or negative, so if it's a positive chronotrope, just know that that increases the heart rate. And just some examples that do that are going to be dopamine, atropine, epinephrine, norepinephrine, also known as adrenaline, noradrenaline. Those are all going to increase heart rate, so they would be considered positive chronotropes. Negative chronotropes are going to decrease heart rate, and an example of that is beta blockers. We talked about beta blockers back in AMP1, but remember, if that's present and then epinephrine gets secreted, nothing's going to happen because the beta blocker is blocking epinephrine from being able to bind to that cardiac muscle. Blood flow. Blood pressure is necessary to move the blood, therefore it's necessary to maintain homeostasis. So when the heart pumps blood through the arteries, the blood is going to put pressure on the artery walls. So take a look at these arrows right here. So as the blood is moving through the blood vessel, there's going to be an increased pressure on the wall, interior wall of the artery, and that is blood pressure. We talked about where blood pressure was taken based on the cardiac cycle previously. So if you're not sure what I'm talking about, you need to go back and rewatch that video. Blood flows from areas of high pressure to low pressure. So just like when we talked about concentration, things naturally move from an area of high concentration to low concentration. Same kind of idea here. Blood is going to flow from an area of high pressure to low pressure. So make sure you understand that. Just to remember what we previously talked about, end diastolic volume versus end systolic volume. End diastolic volume. Remember, diastolic is relaxation. So this is the volume in the ventricles when the ventricles are relaxed. So they just got done contracting, pushing everything out. Now they're relaxed. And what is the volume in the ventricle after it got done pushing everything out? So this is the volume in the relaxed ventricle. And yeah, there really is some. So after contraction occurs and you push everything out, there's still some blood left in that ventricle. It didn't push everything out. So how much is left? That's end diastolic volume. And systolic volume is the volume in the blood in the ventricles just after the ventricles have contracted. So they've just pushed everything out. And I said that backwards. I apologize. This is at the end of atrial contraction. So blood in the ventricles when the ventricles are relaxed. This is going to be prior to contraction. I apologize. So this is as the atrium are pushing blood into the ventricle, again after atrial contraction. What is the maximum volume of blood in that ventricle prior to contraction? That's, again, the ventricles are still relaxed. They have not contracted yet. So that is end diastolic volume. And systolic volume is how much is in the ventricles after you've just pushed everything out. Stroke volume, you're going to need to know the definition. I'm not going to ask you the normal and exercise information. I just kind of put that up there for you guys to kind of get an idea. You're definitely going to have to know about it as you move forward in the nursing program. But one thing I do want to mention is that the normal heartbeat is going to be 70 milliliters per beat. So with every heartbeat, it's going to push out 70 milliliters. And then notice what happens when you exercise. When you're exercising, notice the stroke volume is going to go up to 115 milliliters per beat. So what that means is your heart is going to be pushing more blood out if you're involved in exercise, which would make sense, right? Because your body needs more blood when you're in sympathetic stimulation. You got to get that more oxygen floating around the bloodstream. So the formula for stroke volume is end diastolic volume minus end systolic volume. So if the end diastolic volume were increased, so what happens if we increase this number right here? If the end diastolic volume were increased, then stroke volume would also increase. So you need to understand the relationship. So keep in mind what's going on here. This end diastolic volume is what's going on when the ventricles are relaxed prior to contraction. So if you think about the heart, what is happening with the heart? You have got those AV valves open, which means the blood can go from the atrium straight on into the ventricle. There's nothing preventing that during ventricular relaxation. So you're able to fill those ventricles up with blood because it just goes right on in. Why would you have an increase in end diastolic volume? Again, if you increase end diastolic volume, you're increasing the amount of blood in those ventricles, which means when the heart contracts, it's going to push more blood out, and that's going to be that stroke volume. During exercise is when end diastolic volume will increase, because again, the heart is pushing more blood, so that means more blood is going to go from the body back to the heart again. So that's going to increase that end diastolic volume, which ultimately will increase stroke volume. Now, the reverse is true. If end systolic volume were decreased, that's also going to increase stroke volume, the output, the amount of blood leaving the heart. So how is this making sense? End systolic volume is the amount of blood that is left in the ventricles after contraction has occurred. Well, if you push more blood out, if you have less blood in the ventricles, that means you push more of it out. That's going to increase stroke volume. Again, stroke volume is the amount of blood that's actually going to leave the heart. So again, like I said, you're going to have access to an on-screen calculator during the test. Stroke volume, if the amount of blood in the ventricles, let's say, is 140 milliliters when the heart is relaxed. So think about what that is. What number does that mean if I'm telling you 140 milliliters and the heart is relaxed? What number is that? And the amount of blood that's left in the heart after contraction is only 25 milliliters. So again, what is that number representing? Calculate stroke volume. So the end diastolic volume, the amount of blood that's in the ventricles when the heart is relaxed, that's the maximum amount of blood. That's going to be 140 milliliters. And that means the end systolic volume number would be 25 milliliters. Remember, that's the amount of blood left in the ventricles after contraction has occurred. So in order to calculate stroke volume, you're going to take stroke volume equals end diastolic volume minus end systolic volume. So when you plug those numbers in, you're going to get 115 milliliters. This is the kind of math that we're talking about. So again, you don't really need a calculator for this, but if you feel better having a calculator, you may certainly have one. Now, let's say this person were to begin physical activity. Would their stroke volume be more or less or the same as the 115? So let's say this 115 is during, they're sitting on the couch or whatever. Now, let's say they get up and start working out. What's their stroke volume going to be? More or less or equal to this 115? If a person begins physical activity, their stroke volume is going to increase. The amount of blood leaving the heart with each minute, or with each beat, will increase. So it will be greater than 115 since exercise increases stroke volume. So again, I'm not going to ask you to know the numbers, but you should know that exercise is going to result in an increase in stroke volume. This is just a little video here.
What is stroke volume?
Whoops, pardon me. Just a little video here. It's about 1 minute and 50 seconds long. I encourage you guys to take a look at this. It's got 4 questions at the end, I believe, so it's just a good little video just to make sure you understand stroke volume. And this one, this is about 2 minutes long. So make sure you watch the video and answer the questions. And that is for a grade. That's going to be on your Moodle page. So during exercise, end diastolic volume, that's the blood in the ventricles when they're relaxed, the volume after the atria contract. So the atria push the blood into those ventricles, completely filling them up. This is going to be atrial contraction. Right at the end of atrial contraction is when that end diastolic volume is going to be recorded. Now, end diastolic volume is going to increase because of increased venous return. Basically, you're getting more blood flow back into the atrium, and we can say right atrium for now, from the inferior and superior vena cava. So remember, the inferior and superior vena cava are dumping into that right atrium, and they're dumping more into the right atrium due to sympathetic stimulation, due to physical activity. So the amount of blood returning to the heart from the body is increased. That's increased venous return, which will ultimately increase the amount of blood sitting in those ventricles prior to contraction. Now, end systolic volume is the blood in the ventricles after the ventricles contract. So we're looking, a couple of phases down the line there as to volumetric relaxation. End systolic volume is going to decrease. So the amount of blood left in the ventricle during exercise is going to decrease because the heart is going to contract more forcefully, pushing more blood out of those ventricles, leaving less in the ventricles. Again, you want more of the blood leaving the heart during exercise to get as much of that oxygenated blood as you can to the tissues that are needing it. So again, more blood is pushed out of the ventricles due to more forceful contractions. So because of these two components, the end diastolic volume increasing based on increased venous return, and the end systolic volume decreasing because of the forceful contractions, the two of them together are going to result in a stroke volume increase during exercise. The more you exercise, the more blood is pumped with each contraction, and the more efficient your heart is going to work. So what factors affect stroke volume? Well, you've got a handout in your packet. Preload, also known as end diastolic volume, is the amount of blood in the ventricle before contraction. That's a factor that's going to affect stroke volume. Another one is contractility. We just talked about that. That is the force of the contraction of the heart muscle. Afterload, the resistance the ventricle must overcome in order to eject the blood. So if you've got, for instance, let's say clogged arteries, and your ventricles are trying to push blood out through an artery that's now narrower than it should be because it's all clogged and full of plaque, that ventricle is going to have a hard time getting the blood out of the heart because it's got to overcome that resistance into the blood vessel it's going into. So that's what we're talking about with afterload. So again, that vascular pressure in the artery must be low. Remember, we talked about how the aortic pressure prior to contraction, that's going to be the lowest it's going to be. That's going to represent your diastolic number of your blood pressure. So again, you want that to be low. That way, the ventricles can easily push that blood into that next blood vessel, into the aorta or pulmonary trunk. So the left ventricular pressure must be higher than the pressure in the aorta if that blood is going to go. Remember, it goes from high to low. If that blood is going to go from the high pressure ventricle into the low pressure aorta. If your arterial pressure is high, how much blood do you think is going to be able to get from the ventricle into the aorta if your aortic pressure is high when it's at rest? Not much. It's going to be less, and the heart's going to struggle. So again, things move from high to low pressure. If pressures are equal, it's not going to want to go. The blood flow will go from high pressure to low pressure. So valve damage. The more valve damage is going to create more resistance for blood to move from ventricles to arteries. That's another issue that could happen. So this is the handout that you've got. You've got up across the top factors affecting stroke volume, preload, contractility, and afterload. So these are your three main factors. And here's a list of what raises preload, what lowers preload, and all the way across. So most of this, and just a reminder, end diastolic volume minus end systolic volume is going to equal stroke volume. So just to kind of remind y'all, preload is that end diastolic volume, where contractility is the force of the contraction. The force of the contraction means the more forceful the contraction, the less blood that you're going to have in that ventricle after contraction has occurred. So it's kind of like end systolic volume in a roundabout kind of way. And then afterload, how much resistance are we dealing with? So think about what things that would have to happen in order to raise preload, in order to get that end diastolic volume number high. What kind of things would be happening? Fast filling time. You've got a lot of blood coming into the ventricle quickly. Increased venous return. You've also got more blood flow coming in. So not only do you have more volume of blood coming in, you also have it coming in at a faster rate. So either one of those two is going to increase that end diastolic volume, which will ultimately increase stroke volume. So contractility, what kind of things can raise the force of the contraction of the heart? Think about what you'd be doing if your contractions of your heart, if your heart is pushing blood out harder. So you'd be in sympathetic stimulation, you'd be in fight or flight mode. And what neurotransmitters are being secreted during sympathetic stimulation, that fight or flight mode? Epinephrine, norepinephrine. So if you've got epinephrine, norepinephrine present, that is going to also increase contractility. So sympathetic stimulation pretty much results in epinephrine, norepinephrine, which will increase the force of those contractions. Higher intracellular calcium ions, I'm not going to ask you about that one. High blood calcium levels, I'm not going to ask you about that one. High thyroid hormones, I'm not going to ask you about that one. And glucagon, I'm not going to ask you about that one. So basically know these first two bullets, okay? And then if you, again, like we said, if you lower end systolic volume, meaning you're pushing more blood out of the heart and there's less blood in the heart after contraction, which is what this is right here, then if you decrease end systolic volume, you will ultimately increase stroke volume. So looking at afterload. Afterload, again, is the resistance the ventricle must overcome to eject the blood. If you increase vascular resistance, meaning you're making it harder to get blood into the blood vessel due to maybe valve damage, that means you're going to increase end systolic volume. The blood is going to stay in the ventricle because it can't leave. And if that's the case, look what's going to happen to stroke volume. It's going to decrease. Now, I'm not going to go through the ones regarding lowering because they're pretty much the opposites. Again, parasympathetic stimulation, you should know that acetylcholine is the neurotransmitter involved in parasympathetic stimulation, back from chapter 15. And then decreased vascular resistance. So if increased vascular resistance increases end systolic volume, which decreases stroke volume, then the reverse of that is going to be true. Okay, so now let's take a look at heart rate. Heart rate is defined as the number of times the heart beats or contracts per minute. And again, I'm not going to ask you this on the test, but I do want you to take a look at what happens with the normal heart rate versus what happens with the heart rate during exercise. And as you can see, during exercise, the heart rate is going to increase. What factors affect heart rate? Well, autonomic innervation and hormones. So keep in mind, sympathetic innervation is going to increase heart rate. You're going to raise epinephrine and norepinephrine, which means you're going to increase heart rate. And the reverse of that is true. Parasympathetic, decrease heart rate. Now, keep in mind, with parasympathetic innervation, you're dealing with the neurotransmitter acetylcholine. So know your hormones, know your neurotransmitters with parasympathetic division and sympathetic division. A more fit person is going to have a lower resting heart rate. A less fit person is going to have a higher resting heart rate. Think about it this way. A person who's fit, their heart doesn't have to work as hard to get the blood around the body. A less fit person, they're going to have a high heart rate because, again, their body's going to have to work harder. Their heart's going to have to work harder to get that blood around the body. Age, heart rate actually slows as you age. Females just generally have a higher heart rate than males because females have more body fat than males. Tall people have a lower heart rate than shorter people. More body fat equals a higher heart rate. The heart has to work harder. So know your factors affecting heart rate. Now let's take a look at cardiac output. So there's a short little video here, again, to kind of visualize cardiac output a little bit. The formula is heart rate times stroke volume. So cardiac output, capital C, capital O, also known as minute volume. I'm not going to ask you that, but if you see that, again, look what happens with exercise. So if normal cardiac output is roughly about 5,000 milliliters per minute, when we're dealing with cardiac output, the definition is the amount of blood pumped by each ventricle in a minute. So stroke volume is just how much blood is leaving the heart with each beat. But this is how much blood is leaving the heart each minute. So it's adding a unit of time here. So that's cardiac output. So if normal is about 5,000 milliliters per minute of blood leaving the heart, look how much blood is leaving the heart when you're exercising. 21,000. So quite a bit more. The formula for cardiac output is heart rate times stroke volume. Cardiac output is, again, heart rate times stroke volume, but keep in mind what stroke volume is. Stroke volume is end diastolic volume minus end systolic volume. So you could have a formula such as, and you're going to have to bear with me because I'm drawing on the screen with my finger, so it's kind of going to look kind of weird, but we've got cardiac output equals heart rate times stroke volume, which is end diastolic volume minus end systolic volume. So all I did was replace stroke volume with the formula for stroke volume, which was, again, end diastolic volume minus end systolic volume. So be careful about that one. Just letting you know, hey, there's a formula within a formula here. So again, stroke volume is the amount of blood pumped by each ventricle. Heart rate is contractions per minute, beats per minute. So when you multiply these two together, you get blood per minute, if that makes any sense. So know this information in red. You can see how many different ways I could ask this question. And that's why it's not so much memorizing the content, it's really understanding what's happening. Because if you understand what's going on with cardiac output, then it doesn't matter what question I can ask, you can reason your way to the right answer instead of just memorizing all the different possible scenarios that will get you the right answer. It's a lot less work if you just really understand cardiac output and its relationship to the heart. So cardiac output increases in a person who exercises since their heart is efficient at moving blood. So again, if a person is exercising, their cardiac output is going to increase. If a person who is fit, they have a high stroke volume and they tend to have a lower resting heart rate compared to someone who does not exercise. So we're not talking about they just, they're at rest, now they're exercising. It's basically a person who is fit, okay? They exercise all the time. A non-exerciser may have the same cardiac output, but since their stroke volume would be smaller, their heart rate would have to be greater. Their heart rate is going to have to work harder to get the same results. So in a fit and a non-fit person, you still want that cardiac output to be 5,000 milliliters per minute. But if you're fit, your heart is, with each beat, it's going to be more efficient at pumping that blood. In a non-fit person, it's not. So in order to keep up with the fit person, their heart rate's going to have to increase to push the same amount of blood in a minute. So these are the major factors that influence cardiac output: heart rate and stroke volume. So what factors affect heart rate? Because those will ultimately affect cardiac output. What factors affect stroke volume? Because those will ultimately affect cardiac output. So with heart rate, think about what makes your heart beat faster. Well, fight or flight mode, that's going to be autonomic innervation. That's going to be hormones such as epinephrine, norepinephrine. Your fitness level and your age, these are going to affect heart rate. What factors affect stroke volume? What factors affect the amount of blood leaving the heart with each beat? The size of your heart, the fitness level, gender, contractility, duration of contraction, preload, afterload. So we mentioned some of those previously, just adding a few more. So, because heart rate and stroke volume affect cardiac output, all of these are going to play a role in cardiac output. This is just showing you the same thing, but just on a different handout here. You've got your heart rate here, you've got your stroke volume here. So it just gives a little bit more information. I'll let you take a look at that. Another paper that shows the exact same thing. This one I like a lot better. I think I gave you this one in the handout. I was kind of hesitant to because of the colors. So you might want to go ahead and, if you've got this handout, take a look at the one that's in red and highlight those a different color, because on that black and white copy, that red is going to be hard to see. So you could start right here with exercise. That activates skeletal muscles. That's going to increase venous return, which will increase stroke volume, which will increase cardiac output. Now, if you have decreased blood volume because you lost a lot of blood, that's going to decrease venous return, which is going to increase stroke volume and increase cardiac output. Crisis stressors, mood, trauma, increased body temperature, exercise, low blood pressure, this is going to cause that sympathetic nervous system to kick in. That's going to cause increased contractility of the heart, which will increase stroke volume, which will increase cardiac output. High blood pressure or high blood volume will tell the sympathetic nervous system to back off, and then that's going to then affect everything down the line as well. So just a way to kind of follow a couple of different scenarios. There is a cardiac output video that I encourage you guys to watch. One, because it's good information. Two, because there's also for grade. So take a look at that. It's on your Moodle page. Watch the video, answer the questions. Make sure you do that by midnight on the day of the test. Okay, so now let's take a look at cardiac reserve. So here's just a chart right here. It shows cardiac reserve, and it has various diseases. So you have normal, you have an athlete, a very healthy individual, and then you have these, sample diseases here and how it affects cardiac reserve. So the heart is a muscle, so exercising is going to increase its efficiency, meaning it's just going to work better if you exercise. The difference between the maximum and resting cardiac output is cardiac reserve. Cardiac reserve measures the capacity of the heart to pump blood. So, how much blood are you pumping when you're at rest versus how much blood are you pumping when you're active? And the difference between the two is cardiac reserve. The greater the cardiac reserve, the greater the capacity for exercise. Whoops. So, I wanted to take a look at this. So, right here, look at this cardiac reserve of an athlete. That is just phenomenal. So, the higher the bar, the better. Normal, about 425 or so. An athlete, 600. Now, if you've got some kind of problem with the heart or even the lungs, that's going to affect cardiac reserve. So if you have some coronary artery disease, look at your cardiac reserve. It's only about 150. If you have coronary thrombosis, a lot of clotting in the coronary blood vessels supplying blood to the heart, you're not going to have any cardiac reserve. Diphtheria, mild valvular disease versus severe valvular disease. So these can all affect cardiac reserve. Mean arterial pressure. Mean arterial pressure, MAP. MAP is the average arterial pressure during a cardiac cycle. So it's the average. It determines the amount of tissue perforation to vital organs. So basically how much oxygenated blood is getting to those organs. Normal, your MAP, mean arterial pressure, should be between 70 and 100 millimeters of mercury. You've got to at least have 70 or above if you're going to get blood to the brain. Mean arterial pressure. Your brain has got to have access to blood, and the only way to get it there is to have a average arterial pressure of 70 millimeters of mercury or higher. The formula for mean arterial pressure is cardiac output times peripheral resistance. So, what is the formula for cardiac output? heart rate times stroke volume, and then you add in the times peripheral resistance, and that gives you your mean arterial pressure. Now, what is peripheral reserve? Total resistance against which blood must be pumped. So again, if you've got a bunch of blood vessels that are blocking the flow of blood, they don't have a really nice path of blood flow because they're clogged, they've got a lot of atherosclerosis, a lot of buildup inside those blood vessels, blood's not going to really want to go very well. It's going to be a hard flow. You're not going to be able to get the blood through those blood vessels like you normally would. So that's going to increase peripheral reserve or peripheral resistance. Now, you've got this handout here. I know it looks absolutely mind-boggling, but let's just kind of take it a piece at a time. So what the result is, let's kind of look at the result here. The result is increased arterial pressure. Now, if you look at where this arrow is coming from right here, it's increased cardiac output and increased peripheral resistance will increase mean arterial pressure. And what are the two factors that affect cardiac output? Heart rate and stroke volume. And then what are the factors that increase heart rate? And what are the factors that increase stroke volume? So you're just kind of working your way back up. So let's take a look up here what's in these yellow boxes right here, which is going to ultimately cause an increase in mean arterial pressure. It's going to increase either cardiac output and or peripheral resistance. So if you have a decreased blood pressure, decreased blood pH, increased blood carbon dioxide, decreased blood oxygen, exercise and emotion, any of that is going to cause that sympathetic nervous system to kick in, decrease your parasympathetic, which is going to increase epinephrine, norepinephrine, increasing the force of the contractions, increasing heart rate, increasing cardiac output, increasing mean arterial pressure. So anything that's going to get that heart going, anything that's going to get you engaged in some kind of physical activity is going to ultimately increase mean arterial pressure. Now, I want you to take a look at a few of these that are in this box right here. I want you to make a note of that. So, decreased blood pH, increased blood carbon dioxide, and decreased blood oxygen. You need to know the relationship of these three, so don't just blow that off. You're going to need to know that. So for example, if pH is going to decrease, then that means carbon dioxide levels are increased, which means oxygen levels are decreased. Notice the relationship between pH and oxygen. They do the same thing. If pH is low, that means it's acidic. That means oxygen levels are low. Remember, your blood likes to be basic, right? So acidic is not good. So if you've got acidic, if your blood is on the acidic side, your oxygen levels are going to be low. If your pH is higher, your oxygen levels are going to be higher. And keep in mind, oxygen and carbon dioxide are going to be doing the opposite things. So you need to know the relationship between these three. Okay, now let's take a look at this box right here. Increased blood volume, exercise, changing from a standing to lying down position is going to increase venous return. That's going to increase end diastolic volume, and that's going to increase preload. All that will end up increasing stroke volume. We'll talk about Starling's law later. We're not going to really get into peripheral resistance. That's going to be in a later chapter. But if you increase vasoconstriction, meaning if you increase the constriction of your blood vessels, so they're going to constrict now, that's going to narrow the passage by which blood can pass through. That's going to increase peripheral resistance, which will ultimately increase mean arterial pressure. So again, it's not so much memorizing, it's understanding how all of these work together. I don't have a question set yet for you guys on this one, but again, take a look at those individual videos and answer the questions that follow. And that's going to conclude this video.